The Kwara State Governor has continued his tour of ongoing roads and school infrastructure projects in Ekiti and Irekodun local government areas of the state. Leading a team of his cabinet members, Abdul Fattah Ahmed says he is satisfied with the quality of work done in most of the projects.
I have seen the projects starting from the Secretariat is going on schedule. The Gariami Diamond Split Underpass Bridge is also going on schedule. And also, this road, Ebejila, Asadam Road, is also going on schedule. The funding has been put in place along our infrastructure development fund arrangement, which is currently funding these programs. And we're happy that we're seeing results, and we hope completion will be done as expected. I want to give all assurances based on the funding arrangement we have put in place, which is largely driven by internally generated revenue funding window, which is making it enabling for us to fund these projects. This visit is a continuous thing. We continuously visit our programs to be sure that we get value for money. Yes, we make funds available. Yes, the ministry is on top of its job. Yes, we have a monitoring unit, but we also pay visits so that we ensure that all reports we get is accordance with what is on ground.
Kwara State Governor Mr. Abdul Fattah Ahmed. In the southwestern part of the country, the Lagos State government is promising that residents will no longer have to worry about the sight of waste dumped indiscriminately in the city. The Commissioner for Information made this pledge today when he visited Channels Television. He asked residents to be patient with the government as it addresses the state's environmental challenges.
We have therefore developed a 24/7 waste pickup system that enables us to pick the waste as but of course, there are still some gaps in the process, which we are seeing. But if you look at where we started from, how we started in January, and now you will have seen some reasonable improvement. We will improve as this reform is going on, as the capacity of the company increases, as more collaboration exists between Vision and its allies. But basically, we are on top of it. We are monitoring developments and can assure people that this will soon be over.
Niger State in north-central Nigeria has the lowest immunization coverage in the country. That's coming from the CEO of Global Alliance for Vaccination and Immunization, Mr. Seth Berkley. Mr. Berkley disclosed this during a visit to the state to meet with the government and traditional rulers to seek their support in addressing the issues of non-compliance.
According to the World Health Organization, immunization against diseases averts an estimated 2 to 3 million deaths annually, while an additional 1.5 million deaths can be avoided if global vaccination improves. This improvement is what the Chief Executive Officer of Global Alliance for Vaccination and Immunization wants to see in Nigeria, as he and his team visit the country to assess the level of commitment by the government. The GAVI team, accompanied by officials of the National Primary Healthcare Development Agency and representatives of the Niger State government, is in Suleja local government area of the state to meet with the traditional rulers and seek support in addressing the issue of non-compliance by the people.
The coverage rate in Nigeria is lower than it should be, and as a result, children in Nigeria are dying from these diseases unnecessarily. About a year and a half ago, this was recognized by the government, by Dr. Faisal, who's next to me, and a national emergency was declared to try to increase routine immunization. This visit was part of that discussion to see the progress that's being made and also to sensitize political leadership and, of course, traditional leadership to the importance that is here.
According to Mr. Berkley, the GAVI intervention in Nigeria is expected to end by 2021, but an extension could be considered if the government shows more commitment.
The decision that will be made on whether GAVI can continue to provide support after to 2021 will be based upon the commitment that's been shown by the government and the improvement that is done.
The Federal Ministry of Health and the National Primary Healthcare Development Agency, working with development partners, took a stance and say, unlike in the past when we see coverage surveys that showed that we're not doing enough, we're not reaching our kids, for the very first time last year, we accepted the results.
For the Commissioner of Health, there's a zeal to change how the local people perceive immunization.
And that the time has come for us to do real evaluation, get real results, and know where we are. And that's the first step of showing commitment. Thereafter, we'll now move from there.
According to the Global Alliance team, Niger State has had the lowest immunization statistics in Nigeria, with only 20% of the children vaccinated. GAVI's goal is to help the state achieve its target of changing those statistics to positive figures.